Oh yeah? So let's do some more questions, and I'm going to teach you how to use strategy to answer the question, not just content. Although content is important, you need to know how to be a nurse. So you're caring for 4 patients on the med-surg unit. Each patient has received a new medication order. Which patient should you assess first? So when you see the words first, initial, priority in the last sentence, this is a priority question. There's one that's going to be more time sensitive than the other 3. So let's read them and compare them to each other. I do want you to note, each option, A, B, C, and D, are long, drawn-out sentences. When they're long like this, I want you to find what they all have in common, delete the common information, and see what's left. So let's read it together. We have a 45-year-old with a history of hypertension who's just been started on lisinopril for BP management. 65-year-old type 2 diabetic who just received a dose of insulin Lispro for hyperglycemia. 30-year-old with a history of asthma who's just been given a prescription for albuterol inhaler for acute bronchospasms. 70-year-old with a history of AFib who's just been prescribed warfarin for anticoagulation therapy. So let's compare and contrast these things. So it looks like they all have an age, they all have a previous diagnosis, they all have a new med order and a reason for the new med order. So if we delete what they all have in common, what is left? The phraseology or the words that come between there. So let's see what makes each one different. So A is saying who has just been started. So that means there's an order. B says who just received a dose. C says who's just been given a prescription. D says who's just been prescribed warfarin. So A, C, and D just have new orders, like an order floating around in imaginary land or a paper. B is the only one who received the dose. If they received a dose and it's fast-acting insulin, wouldn't that one be time sensitive? Absolutely. So I can see how some people will get tripped up here and they'll worry about, let's say, the actual medications. Oh, lisinopril versus insulin, albuterol versus anticoagulation. Or they'll see this word, acute bronchospasms. Oh no, but if that patient was really experiencing acute bronchospasms, would we hand them a little prescription? No, we'd hand them the actual inhaler. So this is just another way how you can outsmart the NCLEX questions and not get tricked by some of the terminology, and always think clearly and always be confident in your answer. If you're interested in learning that, I have an entire NCLEX program, and that's what makes me different from any other NCLEX program out there. The link is in the bio. I love you. Bye.